Hello all, welcome to Know Your Medicine, an initiative by Librate, your personalized health companion. In this video, we are going to discuss about Roxit tablet. We will be discussing elements like why it is used, to whom it is prescribed, its consumption and various side effects. Before starting with the theory, let me tell you a brief about this tablet. Roxit tablet belongs to a group of medicines called macrolide antibiotics. It is used to prevent bacterial infections of the urinary tract and inner layers of the skin. It also treats respiratory infections from both upper and lower airways. Roxit tablet prevents bacteria from growing by interfering with their protein synthesis. It binds itself to the bacterial ribosome and inhibits the synthesis of peptides. This medication is generally prescribed during otitis, sinusitis, pharyngitis, tonsillitis, bronchitis and pneumonia. Most common side effects of this medication includes diarrhea, nausea, abdominal pain and vomiting. Less common side effects includes headache, dizziness, vertigo, rashes, abnormal liver functions value and alteration in senses of smell and taste. Your dosage will depend on factors like age, severity of the condition and whether or not you have other medical problems. Take Roxit tablet as directed by your physician. The usual dose is 150 mg tablet twice daily, taken at morning and evening before meals. Warning: please do not take this medication without consulting your physician.